Good morning, friends. In the previous lecture, we have learned about the influenza virus, what type of virus it is, what are the clinical presentation, what are different type of influenza infections, and what is the pathogenesis of this virus. Now, today we will continue that lecture only, and it is a laboratory diagnosis of the influenza virus. That is how we will diagnose the case of influenza infection. So, without wasting time, we will start it. So now the laboratory diagnosis. So laboratory diagnosis starts from what could be the samples we can get if there is any case of influenza infection. So most important specimen we get, like we have learned in the corona infection also, that is a nasopharyngeal swab. This is the most preferred sample which we use, that is the nasopharyngeal swab. Then second option can be oropharyngeal swabs. Usually like in COVID infection we have taken two swabs. We were taking nasopharyngeal as well as oropharyngeal so that we can increase the chance of detection of the virus. So we can take both the swabs in a single case. Then throat swab. Ideally we don't want to go for throat swab, but that can also be another option, that is we can have the throat swab also. Now, any case of viral infection, it is the thumb rule that for virus you have to need a transport medium which is known as viral transport medium, and the sample has to be transported at the 4 degree centigrade to maintain the viability of the virus. So that's very important. It is different from the bacterial samples. So we need a viral transport media. You have to pack it. You have to maintain the temperature at 4 degrees centigrade while transporting the sample to the lab. Now these are the cotton swabs which are not recommended for any collection of the viral samples. So you don't take any cotton swabs for taking any viral sample. These are the Dacron or the rayon swabs which are flock swabs. And you can also see there is a VTM in the tube. So these are screw cap tubes are there. So you have to collect the sample, and these flock swabs are very useful when you are collecting any viral sample because it is very good in eluting the virus into the viral transport medium. Now this is how we can take nasopharyngeal swab. So you can see the direction of the swab. It should not go towards the roof of the you can say nasal cavity, but it should be parallel to the palate. So it will reach to the in the nasopharyngeal direction. So the sample should be taken properly. That is the most important while you are processing any sample for the viral detection. Then triple packaging, that is very absolutely needed. That is whenever you are transporting any sample for detection of the virus, so that sample should be properly packed when you are transporting it to some other place. Now what is this triple packaging? That is like you have a VTM, you have taken the sample and you have kept that swab inside the VTM, break it off, the rest portion which is out, and then you will screw cap it. So this is the first packaging, and that viral transport media or that tube should be properly labeled with the patient name, age, sex, everything should be there. That is the you can also mention from where this sample has been taken, that is the which area samples has been collected, so that all details should be there on the tube. Now that will be, then this VTM tube will be sealed with a paraffin so that there should not be any leakage. So this is the first packaging. Now it will be wrapped with a proper gauze piece or some absorbent material like cotton, and that should be kept in a falcon tube that is a bigger in size of that VTM. So you will keep in that and then again seal it. So this is your second packaging, and the third packaging will be there, that is you can have the thermocol box as it can insulate the sample properly, and you can keep the ice packs inside this thermocol box, and then you will keep this falcon tube in a vertical position so that there should not be any spillage, and also there will be some absorbent material also there so that if there occur any leakage, so it will not spread to the out of the box and to the community. So this is very important, and this thermocol box should be properly sealed. There will be two address, one from the where it is going, that is where you will asking for to process this sample, and second address from where you are sending the sample, whole of the detail. So, and there should be a biohazard symbol. So that is how the sample can be transported if you are transporting it to a distant place. So this is known as the triple packaging. Now what methods can be done to detect this viral infection, that is influenza infection? So one is the antigen detection, that is you are detecting the antigen present on the virus. So whenever in the virology where you are detecting antigen, now what sample should be there? Like antigen is present on the virus, so you have to take that sample where the virus is present. That means if it is a respiratory tract infection, so you need this nasopharyngeal swab, or you have oropharyngeal swab. If it is infection of CNS, so you need the CSF. So depending upon where the virus is present, you need that sample, there will be the antigen present, and you can go for the direct immunofluorescence test. Now second test is the antibody detection. Now for any infection, if you are going for antibody, you need the serum sample. That is the thumb rule. For antibody, you need the serum. Now on serum, what tests you can do? Hemagglutination inhibition test, neutralization test, ELISA. So everybody knows about ELISA, neutralization, and now the main test, which is the hemagglutination inhibition, that is very important because this term you hear only in the influenza infection. Now as I have told you that hemagglutination, they are the papillomares which are present on the surface of the virus. So we are using this hemagglutination for detection tool. Now what is the principle of this tool for this hemagglutination inhibition test? Actually this virus has the capability to bind to the RBC. As I have already told you that it has the capability to bind to the mucin receptor present on the RBC. Now we have taken the serum sample of any person who is infected with the influenza. So the antibodies must have been formed against that infection in the patient blood. So you are taking the serum. Now that serum is being taken in the microtiter plate, and that should be in a dilution way, like we go for the Vidal test. So you have to dilute the serum also. Then you will add a particular virus, that is the influenza only. So that virus you will add to this serum. So if there is any antibodies presented in the sample, so that will bind to the virus. Then you will have then there will be a incubation of 30 minutes approximate. Then you will add the RBC, which has the tendency to get bind to this virus. Now if the serum has the antibody against the influenza infection, so that must have bind to the virus. Now the virus is not free to bind to the RBC. So there will be no hemagglutination. So that will show that if there is no hemagglutination, that means the button of the RBC has been formed, there is no carpet formation, that will be a positive result. That means the patient has the infection of the influenza virus. So a negative result will go in the favor of diagnosis of the influenza infection. Therefore, it is hemagglutination inhibition test that you should know. And as you know that there is a tendency of RBCs that if they are not binding to the virus and they are, when they are kept like this, so they will form a rulex formation is there. So therefore you will notice the formation of the button because this RBC will form a rulex. So that is, if button is being shown in the microtiter plate, it is a positive result in case of hemagglutination inhibition test. Then isolation of virus, you can isolate for any virus, you know, that is you have embryonated eggs, you have cell lines, and third thing, animal inoculation. So embryonated eggs are very much being used not for the diagnostic purpose, but we are using for the preparation of the vaccine. Then cell lines are also being used for preparation of vaccine, that is a primary monkey kidney cell line is being used. Now how you can detect, like you are isolating the virus in the cell line, but in the cell line how will we know that the virus is present or not? So the growth is detected by heme adsorption, and second is the heme agglutination test. Now what are these heme agglutination tests and what is this heme adsorption? Because these three terms are only present in the influenza infection: heme adsorption, heme agglutination and heme agglutination inhibition. So these should be properly understood by the students. So it is very important. Now heme agglutination, as I have told you that this virus has the heme agglutination, peplomers are present on the surface of the virus. So this heme agglutination help in binding to the certain RBCs, mucin receptor, and that will result in the clumping of the RBC, a type of it's not properly agglutination reaction, but there will be a clumping of RBC. So that is the heme agglutination, and that you can use in detection in the cell lines also. Like in cell line, you have cell lines are there and you have added the patient sample, like you have collected a nasopharyngeal swab, and from that you have eluted the virus in the VTM. Now that sample you will take in the microtiter plate, and then you will add a suitable RBCs that can be added, and you will notice for the reaction whether there is some agglutination reaction has been seen or not. Because if there is a in the sample, if there is virus is present, so it will bind to the RBCs and there will be a carpet reaction, like you see in the A, B, so they are coming positive, then all are showing buttons, so they are negative reaction. So where you are seeing the button formation, this button formation is present because there is no virus present, only RBC is present. So RBC has a tendency to form a Rulex formation, that is they stack one over the another, and that is why there is a button formation there that will show negative reaction. So this is very important. When you are seeing a heme agglutination, button formation shows negative reaction, that means the patient does not have infection of influenza virus. Whereas in case of heme agglutination inhibition, which is being done in the serum to detect the antibody, so there the button formation is a positive reaction. So they both are totally opposite. Heme agglutination is for detection of virus, directly virus, that is the virus antigen. Whereas the heme agglutination inhibition is for detection of antibody. So when there will be button formation, that will be a positive reaction. In heme agglutination, carpet formation is the showing the infection of the influenza. That you can see the microtiter plate. So from the bottom side you can see that button formation more clearly, that is showing the negative reaction, and where you are seeing a diffuse carpet reaction, that is a positive to the influenza virus. What is heme adsorption? In the heme adsorption also the RBCs are binding to the virus. But the difference between the heme adsorption and heme agglutination is that in heme agglutination you are taking that fluid in which the virus is present separately in a microtiter plate and you are adding the RBCs. Whereas in case of heme adsorption, that is being done on the cell lines. Like you have a cell line in a petri dish or in the tissue culture bottle, and there the cell lines you have added the sample, you are suspecting that sample may have influenza infection. So if the virus is present, that will bind to the cells and it will enter the cells, and when you will add the RBCs directly on the cell line, that RBC will bind to the infected cells. So that will show you that influenza virus is present in the cell line, and so that is we are directly doing it on the cells, whereas in heme agglutination we are taking the fluid out and we are doing in the microtiter plate. That is the only difference between the heme adsorption and the heme agglutination. Now these are the cell culture. You can say there are different techniques are there. So you have petri dish also, you have flask, you have microtiter plate. So in this viral transport media is there. There are different buffers are there. So what are the different needs for this cell lines? So you can have this. These are the different cell culture method. Now molecular method, which is most important, because usually we are using the molecular method in the diagnostic labs. In the research lab or in the vaccines where you are preparing vaccines, you are going for the cell lines or for the embryonated egg technique. But for diagnosis, we are going for molecular method. In the past, we were doing for hemagglutination as well as hemagglutination inhibition, but now molecular technique is being preferred. It is very easy to know the strain, what type of strain it is, and also it is almost a confirmatory technique and rapid. So it can simultaneously detect influenza A, influenza B, and you can go for RT-PCR, but real time is being preferred. It can quantify the viral RNA also. Now comes the treatment. So specific antiviral therapy is available for the influenza virus infection. Start the therapy within 48 hours of onset of symptom. Now neuraminidase inhibitors are being preferred like zanamivir, oseltamivir, peramivir for influenza A and influenza B infection. Drug of choice for these infections. What is the dose for oseltamivir? Tamiflu brand name. By this brand name it comes 75 mg tablet. Zanamivir 10 mg inhalation form. Schedule, that is given twice a day for 5 days. Chemoprophylaxis given once daily, and duration depend upon the clinical setting, usually the 7 days. There are another drugs usually not preferred: matrix protein M2 inhibitor, amnatidine and rimnatidine. In some of the strains of influenza A, it can be given. And for these strains which are usually being now circulating in our country, they have developed the resistance for this drug. So therefore, we are going for the neuraminidase inhibitors. Now, what are the vaccines available? Vaccines are important. Injectable vaccines are there. So three types are there: inactivated influenza vaccine, cell culture based inactivated influenza vaccine, recombinant influenza vaccine. Single dose is being given intramuscular route, except for 6 months to 8 years of age, where we are giving the 2 dose, and that should be, usually it is being equal to or more than 4 weeks apart. And when we give, what is the timing of vaccination? Usually before the onset of the influenza infection, that is the season, by the end of the October. Side effects, they can be mild reaction, that is a redness at the injection site, fever, ache. So these are the common side effects whenever you give any intramuscular vaccine. The same side effects are there. Serious side effects are rarely being seen. What is the indication? Routine in annual influenza vaccination is recommended for all the person who are aged more than 6 months and who does not have any contraindication. Usually being recommended, but like in our country we have a big population is there, so we can go for the target high risk group, that is those persons who are at high risk of influenza infection like neonates, old age, or who are having any chronic disorder, so they can be first being given priority for vaccination. Contraindication, that is allergy to X or have any history of hypersensitivity to previous dose of vaccine. In this we have to change the vaccine. Travelers, if anyone is traveling to the area of influenza where there is any outbreak or there, so you have to need the vaccination at least 2 weeks before the departure. Then there is another live attenuated influenza vaccine is there, that has been generated by reassortment technique between the currently, actually whenever these vaccines are being formed, every year a new vaccine is being prepared, because they choose the previous strain which was circulating last year and the next strain which they are suspecting that can be circulated in that year. So they make the vaccine depending on these two strains, and every year a new vaccine comes. So this live attenuated influenza vaccine is generated by a reassortment between the current circulating strain of influenza A and B, and they have taken another strain, that is the one strain is adapted to grow at a low temperature, that is 25 to 33 degrees centigrade. So what was new in that vaccine is that it is a live vaccine, it is an attenuated vaccine, but this vaccine has the property that it can grow at 33 degrees centigrade, but it will not grow at 37 degrees centigrade. So when this will, as it is by the intranasal spray, so first this vaccine will reach to upper respiratory tract, so there it will multiply and it will activate your immune system, so antibodies will start forming in your body. When this vaccine reach to the lower respiratory tract, as it is a live vaccine, so at 37, because the body temperature is 37 degrees centigrade, so there it will not able to multiply and it will not cause any symptoms or disease to the person, and so the person will have very mild flu-like symptom and it will not be dangerous to the person. But the efficacy of this vaccine, that is the response, was not so good in that vaccine, although the compliance was very nice with this vaccine. Indication is given to all the healthy person of 2 to 49 years of age except in pregnancy, because all the live vaccines and they are being contraindicated in the pregnancy and also in the immunocompromised group. So that's all for this influenza infection. I have tried my best to cover all the topic regarding. This is very important because influenza infection is very common. Its outbreak are very common in many parts of our country where its outbreak occurs. So we should know what all prevention we should take and how we can manage. If it is a mild condition, we can manage at home also. So this is very important. And if you like it, please give a thumbs up and please share with your friends so that they will also learn from it and they will get benefit from it. Thank you.